Hello, everybody, and welcome. We're very excited to kick things off today with our remote patient monitoring webinar today. So really quickly, I wanted to go over the agenda with you all. We have a really exciting fireside chat to kick things off today. We also have 4 incredible startups from both the health and insurtech programs that our corporate partners have selected for our fall cohort that'll be presenting their remote patient monitoring solutions. So stay tuned for that. As far as housekeeping, we will have questions at the end of the fireside chat and at the end of the startup pitches. So if you have any questions for our speakers, you can submit them using the Q&A button at the bottom of your screen. We're going to dedicate some time towards the end of the fireside chat to answer some questions from the audience. For general comments, you can use the chat feature. And just as a quick reminder to all of our speakers today, we also ask that you stay muted unless you're presenting. So with that and without further ado, I'm super excited to welcome our 2 fireside chat speakers. So first we have Fawad, Fawad has served as a chief data officer for multiple healthcare organizations and brings a wealth of experience in leveraging data as a strategic asset. We also have our very own Alex Tran. He's principal with Plug and Play Ventures for health and insurtech. So thank you to both Alex and Fawad, and I will let you both take it from here.
Thank you, everyone. Thank you so much again for spending time with us today. Again, we are excited to have and honored to have Fawad join us to share his experience at United Healthcare and trends he's seeing in the healthcare space. So thank you so much, Fawad. Today we're going to focus on 2 focus areas: the demand and increase of telemedicine and the rise of RPM, remote patient monitoring. So Fawad, we understand that telemedicine is growing and has increased by 65% this year. I mean, patient adoption at the beginning of 2020 was up 33%. And McKinsey reports are stating that virtual visits could potentially account for $250 billion in healthcare spending in the coming years. How does this impact payers, providers, and pharma, and where do you see the gaps currently?
Yeah, Alex, first of all, thank you for the opportunity. Super excited to be here and listen to some of the startups that are going to be presenting. Yeah, I think, as you mentioned, the telehealth and telemedicine and remote patient monitoring markets are really expanding and have been for the last few years. But this year, especially because of COVID, I think this transformation, this journey has come up by a number of years. And as you can imagine, there's a typical flow to how patients and physicians interact. And that's been going on for a number of years. But with the restrictions and the challenges that came with COVID, both for patients as well as for providers and healthcare ecosystems and hospitals, it became very difficult to take on that additional workload, make sure that they were protecting and delivering care to the COVID patients while continuing to manage the populations that were typically there. So we're seeing a tremendous amount of uptick, as you can imagine, in this space. This market is growing in some respects by, in a logarithmic fashion. What we've seen is that whereas patients and clinicians were usually using technology as a secondary or a tertiary mechanism to engage and to collect data, that's really shifted. It's shifted to a point where I think partially because they didn't have a choice, and partially what's starting to happen is that as people have adopted this out of necessity, they're finding the usability, they're finding that there's a lot of mechanisms that they were leaving on the table in the past. So we're seeing a lot of demand growth. We're seeing a lot of adoption in this space. And in some areas, we've seen this go up by 3, 4, 5, 600% within the course of last 6 months. So definitely a growing market, Alex.
Wow, that's definitely interesting, and thank you for sharing all those insights there. With the rise of with the increase of telemedicine, definitely comes with remote patient monitoring. You know, it comes with all these devices that can grab data to inform these physicians on when to intervene and modify the treatment plans to have the best patient outcome. You know, we've seen this work with platforms like Livongo, Teladoc acquiring Livongo recently, right? So, what kind of trends have you seen in the RPM space? And can you share any kind of use case studies that, United Healthcare has done as well?
Yeah, I mean, I would say remote patient monitoring, I think is really a sustainable market, which is going to be here and it's going to continue to grow. We've seen this grow, in a significant way, especially as it relates to chronic conditions. People that have diabetes, people and patients that have, sort of heart conditions and other type of chronic conditions, where it's not about an event that day or that week. It's more about trends and how people are adhering to protocols as well as sort of managing their long-term health is where remote patient monitoring is coming in. One of the areas which is pretty typical where I've seen a tremendous amount of adoption is on the glucometer side of the house, right? Where people have these devices like these Dexcom devices where you use to check your blood sugar levels and your glucose levels. I mean, that's an area where people would have to sort of do that testing in home. They would have to put it in a notepad, and the next time they went to see their physician, they could sort of share that data with them. And what we're seeing is that while that's useful, I think what's becoming more useful is to have that real-time connectivity with the patients and to have that continuous availability of that data. Now, the other reason I think this market and this use case is growing significantly, and you'll see others come around, right? Whether it's around heart care, whether cardiac care, whether it's hypertension and other sort of chronic diseases, is that from a clinician standpoint, from a health system standpoint, it's interesting to have this data, but it's more interesting to have reliable data. And what I mean by that is that you could buy a lot of devices. In the last 3-4 years, you could buy Fitbits and you can buy Apple Watches and you can buy other devices that kind of give you, some sense of your basic vitals. While those are good, those aren't really actionable in many ways for the healthcare ecosystem, because the quality of data they produce isn't as high as a clinical grade device, right? So imagine yourself in that setting, and you're a participant in the healthcare ecosystem, whether you're an insurance company or you're a provider of these services. You definitely want to make sure that if you're going to make a decision based on a set of data that you're receiving, that it's reliable data. So I think one of the things that I will tell startups and others that are sort of coming into this space and expanding into this space is that while it's interesting to get a lot of data points, it's really important to make sure that you can show that these are decisionable sets of data. Right, this is something that a healthcare provider can actually use and be able to make a decision and then not feel unprotected, because there's insurance issues, there are regulatory issues, there are a lot of compliance issues that come in with that. So we see use cases in these chronic diseases for remote patient monitoring continuing to grow, and I think we're going to see that continue to evolve. But I think where I've seen a little bit of a disconnect is while a lot of startups are starting to say, hey, we can do something with this data, the data collection part itself is sometimes very unreliable.
Gotcha. And, so talking about the data, collection and how it's being unreliable, I understand recently, United Healthcare just made an acquisition in an RPM company called Vivify Health. At the time, they just had raised 24 million. United Healthcare being the largest healthcare company by revenue, bringing in 242 billion, last year. What made Vivify Health, so appealing, and what validated them on their data collection for you guys to make that acquisition?
Yeah, I mean, I think Vivify and there are a couple other players out there that have done a really good job of understanding that the reliability of data comes first, and then all the clinical pathways come second, right? And one of the things that Vivify and others have done, a couple others, is that they sort of started with building a data platform first, right? So they sort of thought of themselves as an aggregator of IoT device data. So if you think about it, right, these devices that we're talking about, in many cases, they're kind of like any other IoT device, right? This is these are devices that have some very consistent behavior. And what I mean by that is these are reliable devices made by third-party organizations. These devices are very chatty, meaning that they push a lot of data out. This is not like, hey, an update every hour or an update every day. In many cases, they're sending out updates every second or millisecond or multi-second, depending on what the situation is. So I think companies that are looking to penetrate this space and are thinking about the data first approach will probably have a little bit of a leg up longer term, right? Because if you start with the healthcare use case, I think that's one approach to come at it and try to solve the problem. But I think the question of reliability is going to come up over and over again if you come from that angle. I think if you come from an angle to say, hey, we're aggregating data and we want to make sure that we can deal with the velocity, we can deal with the variety, we can deal with the reliability of this data. I think that's where large-scale organizations will be more attracted to either acquiring or partnering with these kind of organizations, because they're looking for reliable outputs. And if you have a data-first approach where you can not only just say, hey, we can deal with these millions of interactions that are coming from hundreds of thousands of patients, but we can also reliably tell you that this data set is accurate. I think that's where the value starts to come in. Now, the use cases have to be there, right? I mean, you have to have a point of view on what market segment you're solving for. How do you differentiate? What can you do beyond just giving a physician or a health system basic information? Can you sort of do some analytics on it and say, hey, this is what we see the trend going towards? Or can you share some insight? So data reliability is very, very important. But the funny thing is, the intelligence on that data is perhaps the most useful thing for both the patients and the clinicians. So it's important to build that foundation, but then not to forget about the use cases and the usability that sits on top.
Gotcha. And what do you think would be like, how can startups prep themselves, for, when they go out to payers, what can they do to help make that, validation process a lot easier, for payers like yourselves in order to, utilize their solutions?
Yeah, I think, look, what startups have is, they have innovation, they have new ideas, they have agility, and they're trying to solve new problems. What they don't have are customers, right? They don't have a brand. They don't have access to data, that sometimes they need. So I think those partnerships obviously make a lot of sense. But to be able to make those partnerships attractive, I think there are a few things that you got to be able to bring to the table. One we talked about, which is the reliability of the solution, and especially the data that you're bringing in. I think the other thing is that you got to figure out who your customer is within the health ecosystem, right? And I think sometimes people come up with ideas that can have many customers, but they don't identify the specific customer. So I'll give you an example, right? So if you're doing remote patient monitoring, are you aware of what the Medicaid rules are related to remote patient monitoring? Do you understand what Medicare requires? Do you understand what commercial grade insurance requires? So even the same solution could take a lot of different lenses depending on the line of business that you're going after. So one of the advice that I do give startups is that as you're starting to build these kind of solutions, also think about the the customer and who that is, and not just, hey, my customer is going to be a large health insurer. Within that health insurer, which line of business is going to be your customer and why, and then tie the benefits back to them, right? So there's some new regulation, for example, that's coming in called interoperability, which is going to impact some of these segments. And these are rules coming from the government, which are going to force payers and providers to share their data across the ecosystem. As part of that journey, for example, Medicare and Medicaid may have much higher adoption based on some of the regulatory framework that's being put in. So if you're building a solution and you have this support from regulation coming in, then you may want to just sort of pivot to that market first, right? Because that's an area where somebody's going to be looking for solutions. That's where payers are going to be looking for solutions. So part of this is really the technology and the science, and part of this is really looking at the macroeconomic trends, and especially the government regulation that's kicking in, and trying to figure out how you can build that solution that's not only just useful for customers or consumers, but also for the entities that are going to deliver to the consumers, like payers and providers.
Thank you, Fawad. And I mean, so like, it looks like they have a lot of good amount of prep work to do, and I think you shared some good insights on what they're looking for. Now let's switch this back to payers that are trying to review startups. When it comes to implementation or figuring out specific metrics for a POC, what are the best practices that you can share to make sure the innovation process is as smooth as possible?
Yeah, so I mean, look, over the course of my years, I've worked at Kaiser Permanente, I've spent time at United Health Group, and we get calls from all sorts of startups wanting to, sort of bring their solution to the table. And a lot of times what we find is that they have a really, really good set of ideas, and they've built some really good technology. But the question for us in many cases comes in two areas. One is this a viable company? How far along are they in the process to be able to leverage this technology platform? And the second thing is, are they solving a specific problem? Sometimes what we see as a challenge is that companies will come in with broad sets of solutions, but they don't have a specific area that they're trying to solve for. And I think that that specificity will help you get in much faster than trying to say we can disrupt all aspects of it, or 5 different things that we can solve for. We can solve for your regulatory thing, and we can solve for your patient monitoring, and we can do a telehealth platform, and we can do scheduling. Instead of sort of doing 5 or 4 or 3 or 2 different things, try to figure out that one thing that you can do really well, and then come to the right customer base within the payer environment and connect with them. And I'll tell you, more often than not, people try to go after the commercial business because that's the largest, higher margin business. But what I will say to you is, in most cases, the Medicare and the Medicaid business have a lot more needs and demands, even though that's not the highest margin business. So segment your target audience and have a very specific solution within that segment as the first area of adoption or outreach. And then as you make some POC progress in those, and you're more likely to get that response back to say, hey, this is interesting. It's not going to take a whole lot. This is something that we are trying to solve anyways. Let's try to bring it in. And then add layers in terms of what else you want to do with your platform or your technology.
Awesome. As startups and large hospital corporations like United Healthcare or big pharma companies are trying to validate solutions in the RPM and telemedicine space, let's bring it back to like providers. In order for them to adopt new services, a lot of it correlates with medical billing.
Yep.
How do you think these RPM data points are going to tie into the medical billing process for the providers? Because it's going to be hard for them to offer this type of service if they're not going to get reimbursed on it. What are trends or advice you can give in that sense?
I think, look, what I'll say first is that providers are are kind of getting squeezed from all angles, right? I mean, they're getting squeezed from health insurance organizations in terms of their payments are being cut in many ways. They're dealing with increasing regulation and patient care protocols that's taking a lot of time for them to see those patients. And they're seeing, they truly, if you talk to provider organizations or providers in general, what they'll tell you is that they feel like they're getting squeezed from both ends. So I think if you're in that situation, you're definitely interested in things that can solve for those two problems. How can I get better payment and more reliable payments from the insurance entities? And how can I engage with my customers to simplify the workflow or do some of the workflow before the patient shows up in my office so I don't have to do the repetitive work at a very expensive time. So I would say the providers, are interesting places to go to help solve these problems, but I've seen difficulty in getting adoption at that level because a lot of these folks are really they just don't have the time or the capacity to do it. Now, what you do want to do sometimes is find these larger groups and organizations where there's 1,000 providers or 500 providers or 2,000 providers have come together to build an association or an entity. I think there you're going to have a much better opportunity to bring these kind of solutions to the table. Versus if you go after smaller providers, I mean, those guys are just so swamped that they'll give you some advice, they'll be able to give you some input, but I don't know if they're going to be really customers unless you're solving for something very, very unique, which typically I haven't seen out in the marketplace.
Gotcha. And, with providers trying to figure out how to, bill for this, we understand that there's about 3 to 4 CPT codes out in the market right now that payers are reimbursing on. And just by enabling our providers to monitor vital signs remotely and get paid, on average of $210 a month, to achieve on each patient, to achieve value-based care versus, fee for service. I mean, what are your thoughts on, that trend? Do you think this is going to enable our providers and increase better outcomes, with, a preventative approach or, or otherwise? Yeah.
Well, I think the science is very clear on it, right? I mean, if you wait for a patient to show up to your office, you've already lost the battle, right? I mean, I think the reality is that what you do or do not do on the 364 days that you're not in the hospital or you're not in front of your provider is probably more impactful on your health in many ways than the time you show up. So I think there's really real tremendous value in giving these kind of services to patients for just better health outcomes. It reduces readmission rates. It provides a lot of interesting sort of insights into patient behavior, which can then be used to guide patients on the right path. I think there is a little bit of friction today. As you mentioned, there are some CPT codes, but I don't think 3 are plenty. I think there's so many different mechanisms for doing this kind of monitoring that we're going to need a lot more CPT codes. And I'll bring it back to where I started, which is I think because of COVID, because of all of these factors where people are not necessarily able to go to the physician as often as they have been, I think I'm starting to see a lot of push in Washington and in these regulatory bodies and some of these organizations that decide these payments to add a lot more of these codes. So I suspect over the next 12 and 24 months, you'll see an additional number of CPT codes that will be added so that providers and payers can charge for more of these services, because at the end of the day, it really does help the overall ecosystem. It does help that patient and member live a much better life if we have a sense of dealing with their problems before they show up to the hospital or the emergency room.
Yeah, thank you for your feedback and the answer there, Fawad. So it looks like we need to move on to our Q&A portion. So we have several questions here from our audience. Looks like the first question we have here is, can you specify which area there has been a 300 to 500% increase in telehealth?
Yeah, so we're seeing it in a couple of different areas, right? One is just the most basic of services, right? So I would say, where people used to just sort of show up to a physician to get a refill, or hey, I'm not feeling too well, or I need some sort of non-emergency sort of care. I think in those areas, because the providers and were so caught up with dealing with COVID, and the protocols were sort of unclear on who can go to the hospital versus not, I think we're seeing a lot of demand there. In companies like Lemonade Health and others that have developed these workflows that allow you to sort of deal with these kind of questions online and then be able to get care, I think those folks are going to see, those are the areas where you're seeing that kind of demand and growth come in. So the most basic services, I need a smoking cessation, medicine. I have some refills. I need some hair loss medicine, or I need some sort of, sexual health related medication or advice. I think those are areas which are easy to automate. And I think that's an area where people are getting a lot more comfortable with dealing with a screen versus seeing a physician face to face.
Thank you. Next question is the authenticity of the data in RPM critical, or do you see a potential for fraud in data collection?
I mean, today, if you go with some of the reliable organizations, you do the analysis and make sure that the data is of high fidelity. I mean, if it's not, then fraud is not what I'm worried about, right? What I'm really worried about is, and what the ecosystem is really worried about, is making a decision based on a data set that comes your way that turns out to be the wrong decision for the patient, right? Or losing, sort of think of it, it's a double-edged sword. One is that if you get bad data and you make a decision, and that decision happens to be the wrong decision for care, that's a bad outcome, obviously. The flip side is that you lose, you say, hey, this data generally isn't good, and an event happens and you don't make a decision based on it because you think the data is always unreliable, and then that one instance the data happens to be reliable. So the liability for physicians and providers is quite high already, and adding unreliable data to that does not help to solve the problem at all.
Gotcha. No, that's great insight there. So next question is, so curious to see how healthcare providers, organizations think about the chargeback model, reimbursement model for remote monitoring. Are tools, platforms doing anything particular to help facilitate this? Are you seeing anything?
Yeah, I mean, I think, look, yeah, I'll tell you on the payer side, I mean, a lot of times payers get a really bad rap because they're looked at as somebody that's just trying to not pay out claims. But the reality is that the payers have just as much equity in better health outcomes as anybody else does, right? And from their standpoint, they're not looking at every one of these activities to say, is this going to be a profit-making event or not? I think payers are just as interested as providers in most cases in making sure that there are less readmissions, that people don't go to the ER. Because not only is that just bad patient experience, it does have a cost element. So if they can do something to reduce those kind of outcomes, I think they're aligned to the right platform, the right technology that helps them solve that problem.
Thanks, Fawad. And I think we got one more question before we wrap up here. But as the chief data officer, you were managing a lot of data coming in and coming out. I imagine with RPM and telemedicine, more data is going to be sitting up there in the cloud. For large organizations like yourself, like with big pharma or hospital providers or carriers looking to rely on this type of data and hosting it. What kind of advice can you give to them, or what should they be looking out for? And prepare for this?
Yeah, I think, look, I think I think from a, just as startups are sort of struggling to figure out how to penetrate some of these payers and large provider networks, I think a lot of the payers are struggling to figure out how do they manage their own data. If you sort of look at some of the larger payers in the industry today, they've been around for a long time and they have a lot of legacy technology, right? So I think, you know, a lot of on-prem, a lot of legacy things that run on mainframes still. You'd be surprised how much mainframes still exist in the payer space specifically. So I think there's a general demand and an understanding that the way data is managed and brought in and pushed out has to change. And I think all the same technology and platforms that you're seeing non-healthcare entities leverage are going to be just as relevant for the healthcare space. So going to the cloud, having a more cloud native solution, having more integration and interoperability with a number of EMRs and other, you know, other platforms that play a role, I think is going to be continuously critical. And then I know I mentioned it a couple of times. I think this interoperability regulation, which sort of takes the patient record away from one EMR and from a jurisdiction of one hospital or one provider to a point where it's going to be sort of freed up and owned and moved with the patient as they go from one to the other. I think that's going to drive a tremendous amount of innovation. And that's going to start with getting off of some of these legacy systems, going to more cloud-first technologies, going towards more, you know, real-time things versus kind of events where things happen and are updated on a periodic fashion. So I think all the trends you see in general enterprise are happening in healthcare. They're just happening from a slightly different lens. And that's what I see so far.
Wow. Well, thanks so much again for all the insights and knowledge you shared with us today, Fawad. This wraps up our fireside chat, and we're excited to move on to the next portion. I'm going to pass this back to Ava, but thank you so much again, Fawad, and thank you everyone for listening.
Thank you.
Yes, thank you again, both Alex and Fawad, for a great discussion. Fawad, thank you so much for sharing some of these really great nuggets and insights on both the trends and the overall remote patient monitoring landscape right now that's evolving so rapidly. So very excited for this next portion of this webinar. We have 4 startups that are all currently participating in our health and InsurTech programs here in Silicon Valley. So these are startups that our corporate partners have selected, each with unique remote patient monitoring solutions. So very excited to showcase these all for you. Each startup will be pitching for about 4 minutes, and there's going to be a 2-minute Q&A at the end of each pitch, where the startups will join us live to help answer those. So during the pitches, feel free to ask your questions in the Q&A box down below. If you're interested in connecting with the startups that you see and to learn more, there's going to be a poll that'll pop up on your screen. So feel free to answer yes if you'd like an introduction to that startup. So with that, I'd love to welcome our first startup, Kit.
Hello, my name is Philip Fong, and today I'd like to introduce to you Kit, the at-home blood testing solution for remote patients. First, I'd like to start off with a brief example video showing the initial Kit product catered towards the life insurance industry.
Welcome to Kit, state-of-the-art at-home diagnostic testing delivered to you. Kit provides the user with the ability to complete their life insurance exam with one simple at-home box, while providing insurers with familiar and comprehensive data for underwriting. Our smartphone app provides step-by-step guidance throughout the user journey to make it simple and convenient. A blood pressure monitor is provided to measure systolic pressure, diastolic pressure, and pulse. A saliva kit is provided to detect smoking, substance abuse, and other risk factors. A scale is provided to measure a user's weight with instant verification. A finger prick kit is provided to take a micro blood sample for testing all the common health markers, such as kidney, heart, and liver function, as well as diabetes, HIV, and other diseases. Components used are proven instruments trusted by healthcare professionals. Throughout the entire sample collection process, Kit makes use of our patented fraud prevention technology. Kit keeps track of users as they complete each step to ensure end-to-end reliability and chain of custody throughout. Kit is here to help make life insurance a modern, simple, and convenient process. Partner with Kit today to help convert more of your insurance applicants.
At a high level, the problem Kit is trying to solve is that remote patient blood testing is hard. The existing paradigm of remote patient testing requires a clinic visit or a visit from a mobile phlebotomist, both of which may be inconvenient and difficult for a patient. We believe the future of monitoring goes down a different path, and that solution is Kit. Kit is like an Amazon for medical exams. A box is delivered to a patient's home and allows the patient to do a full self-guided blood test at home. This has the advantage of a convenient, contactless, and modern experience for the patient, resulting in more reliable monitoring for the provider. Test processing is at the heart of Kit's DNA. We spent the last 2 years developing and staffing our own high-complexity CLIA laboratory from scratch, with certifications equivalent to that of a hospital lab. Unlike most labs, we're 100% focused on over-the-mail testing and have developed new technologies to make over-the-mail testing for common blood tests possible and stable, and can process thousands of kits per day. Kit is not just about mailing a box to your patient. It is also about making sure the patient opens the kit, completes the kit correctly, and has verification of the user's identity. We use the power of the smartphone to guide the user through an interactive process, while using video identification and tamper-evident packaging to make sure that there is chain of custody throughout. Kit is currently focused on our initial product for the life insurance industry, i.e. replacing the paramed exam with a modern over-the-mail experience. We see other applications for Kit as well, for example, in clinical trials monitoring, chronic disease monitoring, and telehealth. We would love to discuss applications that you may have. So that's a little bit about Kit, the at-home blood testing solution for remote patients. We'd love to talk to you about possibly using Kit for your patient monitoring flow. Thank you.
Wonderful. So there is a poll that should have popped up for everybody. If you'd like an introduction to Kit. On the line, I believe we have Philip.
Hi, how's it going?
Good, how are you?
Good. Thank you for having me.
Of course. So as we wait for questions to pop into the Q&A, tell me who is an ideal partner for you?
So, like I said before, we are 100% currently focused on the life insurance industry. We have a lot of partners in that industry that are replacing the paramed exam with our at-home kit. They find our kit extremely easy to use, and we also verify the user's identity via smartphone, which I think is one of the big issues with this type of test. So that's our current product, but again, we've had a lot of inquiries from telehealth, from clinical trials companies as well. So definitely open to talking about those other opportunities.
Wonderful. And someone asked, are you currently raising a round?
Yes, we are.
Great. And how is Kit able to assure damage control or quality of completed samples?
Yeah, so that's a great question. So, like I said before, like a kit is not just about mailing a box to a patient. It's also about making sure they actually complete the kit and they actually open the kit to start off with, and all these other issues. So we spent a lot of time making sure that the user actually opens the box, actually does the kit correctly. We monitor them via smartphone. If we see there's anything wrong, we also have a person that can jump in to help them. And so there's a lot of things that we're doing behind the scenes that's not just mailing someone a box, and I can go into those further. But there's a lot of thought that we put into this process. There's a whole funnel in opening the box and getting through the entire process that we monitor very carefully.
Wonderful. And I know there's quite a few questions that are coming in, but we do have time for one more. Do you have any international customers? Are you ready to go to Brazil, for example?
We have had a lot of inquiries from Brazil specifically, and we do not have a capability right now to work in Brazil because our CLIA laboratory is in San Francisco. However, I think our technology can be ported to a laboratory that's more local to Brazil, so I don't think that's out of the question.
Wonderful. Well, that's all the time we have today. So thanks, Philip, for joining us.
Thank you so much.
Great. And up next, we have Heartbeat Health.
Good afternoon. My name is Daniel Friedman, and I'm a product manager at Heartbeat Health. I'm also a medical student and business student at Columbia University. Heartbeat Health is a virtual cardiology company, and for the next 4 minutes, I'll take you through how we manage cardiovascular disease with a digital-first model. To set the scene, let's start with a sobering statistic. Someone in the US dies from heart disease every 37 seconds. That's the leading cause of death for women, men, and nearly every racial and ethnic group in the United States. It's a disease that spares few, killing well over 500,000 people each year and costing hundreds of billions of dollars in its wake. And here's the specific breakdown of where Heartbeat steps in. We manage patients with moderate and high-risk cardiovascular disease, focusing on the true clinical members of a population. Of these, 33% have moderate and high-risk heart disease and cost an additional $2,500 per year. Then we have the 6% who are the acute high utilizers, patients bouncing in and out of the hospital and costing about $30,000 per year. As a company, Heartbeat has 3 key differentiators. We're clinical first, founded by a cardiologist and built with actual clinical experience in patients from the ground up. We're scale-oriented with a national network across the US and now the largest national network of virtual cardiologists. And finally, we're focused on ROI, achieving better outcomes at lower cost for the populations we serve. We've memorialized some of these distinctions earlier this year when we won the contract to be the digital platform for the American College of Cardiology, the ACC, and their 28,000 cardiologists across the US. So our story. Heartbeat started in 2017, and we've seen rapid growth over the last 6 months as we closed our Series A with Optum Ventures and 406 Ventures, launched our app, and managed our 50,000th patient. So where is our sweet spot? Many existing digital health interventions focus on wellness and coaching, and we've taken on the higher risk category of real clinical management, which generates a much higher cost savings along with significant reduction in disease. Heartbeat has 2 programs. The first is called 100 Days of Heartbeat for the high-risk and post-hospitalization patients, those with heart failure, coronary disease, and arrhythmias. The second is called Heartbeat 365, which is our ongoing care program for the moderate and high-risk patients, those stabilized but with active cardiovascular disease. And this is how it works. We're a 2-sided app for providers and patients, and we bundle remote patient monitoring, telemedicine, cardiac rehab, and an analytics engine that supervises all clinical data. The provider side looks like this, with virtual queues, panel management, group engagement, and diagnostic tracking data. And the patient side is simple and easy to use. We track device data, allow interactions with care teams and your family support systems, and we provide straightforward communication and telemedicine. Care transitions happen seamlessly as patients begin a program of care in the hospital and then move to their home. I'd like to close by highlighting that we were evidence-based and outcome-driven. Shown here is a case study in which we focused on a post-hospitalization population of 8,000 patients. Using our digital-first care process, Heartbeat reduced ED visits and hospitalizations by 39%, compared to the prior benchmark and industry average of 8%. So that's Heartbeat. I would like to thank you for listening, and I welcome any questions.
Wonderful. Thank you, Daniel. And I think we have you on the line.
Hey, thanks so much for having me. Happy to be here today.
Great. So for anyone in the audience, if you'd like an introduction, fill out the poll. We do have a question that came in. Are you considering international markets?
So right now we are US focused, but heart disease is certainly a global issue. So I definitely see this as a direction we'd go in the future.
Wonderful. And we have another question. Is this a mobile-only solution? Have you had any issue with older, more vulnerable populations not having a smartphone?
It's a great question. So right now we've started off mobile first with the rationale that most of the devices are more updated, more modern, and it gives us a little more control in the process. As for the older population and more vulnerable populations, that's definitely something we've thought a lot about. It hasn't shown to be a huge issue for us because so smartphone penetration throughout the country is actually extremely high, even among older populations and people with lower socioeconomic status. So far, this has not been a huge barrier for us. We've focused both on iOS and Android, so we really haven't limited ourselves with that respect.
Great. And are you currently raising?
We currently are not raising around. We closed our Series A a few months back.
Great. And we have time for one more question. Do you have your own provider portal?
Yeah, so actually there's an entire provider-facing app, and that's how providers sort of engage with patients. It gives them an inside view of what's going on with their patients, and they can access the data both before the visit as well as during the visit. So we're making sure that data can be reviewed sort of at the point of care and these point of interactions with the patients to make it, if you're reviewing remote patient monitoring data, for example, you can really make that review process interactive with the patient.
Wonderful. Well, thank you, Daniel, for joining us. So we don't have time for any more questions today, but thank you again.
Thanks so much.
Wonderful. So up next, we have RX Live.
My name is Mark Anglin, and I am the CEO of RX Live. At RX Live, we are passionate advocates for the role that clinical pharmacists can play outside of the retail pharmacy setting. In fact, we think that pharmacists are some of the most underutilized resources in healthcare, and study after study has shown that their direct involvement in primary care as well as other settings have driven remarkable outcomes like the one shown on the screen. In fact, for every dollar invested in in-depth pharmacy counseling, there's about an 8x return in both near-term drug spend as well as longer-term medical cost avoidance. So at RX Live, what we are doing is building essentially a technology platform, but we're also a nationwide marketplace of part-time clinical pharmacists. And we integrate those pharmacists directly into physician groups, as well as employers, payers, and other circles of care. And the way that our model works is that the patient is introduced by the physician or their staff to our pharmacist. Patients then talk to our pharmacy team over the phone or over video chat, typically for about a 30 to 45-minute, very in-depth consultation. These models are reimbursed by Medicare and the wealth and explosion in innovation in care management codes and other fee-for-service opportunities. It can also be reimbursed directly by insurers or by self-insured employers. And from a business model perspective, our pharmacists are paid per piece. What we do is integrate this very thoughtfully into existing care management workflows and primary care workflows such that we build patient registries and then really enroll patients in this pharmacist outreach and intervention centered around existing office visits. We use a whole variety of additional telemetry as well as medication cost alerts through SureScripts and other integrations to feed that registry. And then what we do is pair our pharmacists one-on-one with patients and then longitudinally engage either on a quarterly, biannually, or per clinical necessity. But we're much more than just a technology-enabled service. We've built a proprietary technology stack that collects the clinical, behavioral, and social data across all the consultations that we have. We then use real-time behavioral, clinical, and other algorithms to drive clinical decision support to our pharmacy team at the point of care, and then use additional machine learning models to really identify interventions proactively. We customize and automate patient and provider communication, communicating directly through our physician customers, EHRs. We've integrated telehealth into this application. And in essence, what we're doing is leveraging our human cloud of pharmacists to refine and develop our machine learning protocols in real time. So from an analytics perspective, in addition to the pharmacist integration, what you also get is a robust reporting environment that summarizes all of the clinical interventions in real time, down to the medications prescribed, the changes, discontinuations, where we see discrepancies in the patient's chart, as in what they're not taking. And all of this is then summarized not only at a medication level, but we go layers deeper to understand the why behind the patient financial as well as compliance barriers that we see, why behind the medication change recommendations, such that in aggregate for an organization or a provider, we can take a holistic look at, for example, a diagnostic category like type 2 diabetes, looking at all the medications that are being prescribed, all of the changes associated with that, even down to medication possession ratios and provider adoption of some of our clinical recommendations. And this combination of services, technology, as well as analytics drives a stakeholder experience that looks like this. So for physicians, we can save time, we drive incremental revenue, and clearly improve clinical outcomes and quality performance. The vast majority of our patients save money to the tune of about $50 a day, and we're obviously improving their day-to-day experience around their drug-taking behavior. And from payers and employers, it's all about saving money, improving quality metrics. We have also been able to show reductions in important diabetic outcomes, reductions in readmissions through physician practices adopting our technology and tools, such that the overall aggregate ROI is about a 4 to 5x for providers, and we've even been able to demonstrate an ROI of over 20x in some of our employer-based models. And so at the end of the day, what we are providing to our physician partners is a much more holistic approach to pharmacy integration, where we think strategically about the administrative pain points around pharmacy, fee-for-service programmatic opportunities, but also value-based opportunities, and really think about integrating hybrid fee-for-service strategies that align and help build value-based models and infrastructure for population health-based initiatives. And so in summary, RxLive is a combination of services, technology, and data that we believe is poised to address one of the fundamental challenges in healthcare, which is medication mismanagement, in a very novel, but very patient and very provider-engaged way. Thank you for your time.
Great. Mark, do we have you on the line?
We do.
Great. So again, for the audience, a poll just popped up if you'd like an intro to RxLive. We do have a few questions from the audience. So how do patients discover RxLive?
So we integrate very deliberately with population health and other care management teams. And so we build patient registries. Those registries are typically centered around a patient's existing office visit. And so it can come from the provider, from their staff, or we have our own enrollment pathways.
Great. And how do patients, primary care doctors get to know RxLive?
Yep, so they're our customers. So most of the time we engage with risk-bearing physician organizations. We can also be kind of a provider network engagement strategy for payers. And we also work with self-insured employers. And so there's a variety of different models that we use to engage providers in each one of those different cycles, but typically we view them as the core customer.
Wonderful. And there was a question, but you just answered it. So we had one question just come in. How has engagement with the solution been so far from the patient side?
Excellent. So we obviously track every patient satisfaction metric under the sun, and our average net promoter score is between 65 and 70, typically averaging about 9 out of 10. And it's easy to understand why. We're saving patients money, we're helping them take fewer medications, and because of that really tight integration back with their primary care provider, they're having an opportunity to discuss the pharmacist's findings within a week of meeting with a telehealth consultation with a pharmacist. So it's a very patient-centered way to think about pharmacy.
Wonderful. That's all the time we have today for questions. So thank you again, Mark, for joining us.
Thanks, Anna.
Okay, and last but not least, we have Neurologics.
Hello, everyone. My name is Mark Cipozzoli, and I'm the CEO and co-founder of Neurologics. We are an effective AI company, which is the intersection between effective computing and artificial intelligence. Let me begin by asking this question. What if you could check your health using nothing but your smartphone in just 30 seconds? Our answer to that question is you could check your health in 30 seconds if you had Anura on your phone. Anura provides you with a plethora of general health and wellness information in just 30 seconds. Anura is the world's first app to allow for blood pressure measurement using just a selfie video from your smartphone. In addition to blood pressure, Anura provides medical grade accuracy for heart rate, breathing, heart rate variability, cardiac workload, mental stress, body mass index, and cardiovascular disease risks. All of this is then distilled into an overall general wellness score. The current version of Anura increases the user's awareness of stress, hypertension, and cardiovascular disease risks. In addition to that, we are working on new features for future releases, which include blood biomarkers such as A1C, cholesterol, and hemoglobin, mental health indices for anxiety and depression, physical indices like body shape index and waist to height ratio, which will help us to estimate your risk of type 2 diabetes. We have also developed a COVID-19 model in collaboration with St. Michael's Hospital in Toronto, the University of Toronto, and Zhangde Hospital in China. The model will give you a probability of being infected with COVID-19 based on your current symptoms. In addition to Anura, the mobile app, we have developed Anura Heart Magic Mirror, which we're calling the world's first health appliance. In addition to all of the Anura measurements, it will allow you to measure blood, body temperature plus blood oxygen saturation, and much more. It will act as a home health appliance, a telemedicine portal, a health check station, and much, much more. So how does it all work? Facial blood flow data is extracted from a selfie video by the client app, running on a smartphone, tablet, or laptop, using our patented technique called transdermal optical imaging, or TOI. The blood flow data, or TOI signal as we call it, is sent to our cloud-based effective AI engine called DeepFX, which then applies advanced AI models to predict and measure selected physiological and psychological states, what we call points. Results are returned to the client app for display. This is the basis for our SaaS-based revenue model, where the client pays on a per measurement, per user basis based on the number of users and number of measurements. The general market sector we play in is digital health, a market which was $106 billion in 2019 and is projected to grow to $639 billion by 2026. We are currently engaged with 50 plus customers at various stages of evaluation, POCs, and integration of our technology across multiple verticals. These customers range from startups to Fortune 500 companies. We have just started generating recurring revenues and have a rapidly growing sales funnel across multiple verticals. Some specific use cases for healthcare are telemedicine, where our technology is being used to create mobile/home telemedicine platforms with the ability to measure key health parameters such as blood pressure using just the video camera. Corporate wellness, where our technology is being used to monitor the health and wellness of employees for the benefit of improving employee health and productivity and lower healthcare costs for employers. We have a growing patent portfolio with 8 patents currently granted and 6 more pending, the crown jewel being the blood pressure patent for now. We have done multiple rounds of financing since inception, having raised a total of $20 million Canadian. There are no institutional investors in the company. The CEO and co-founder, i.e. me, is the lead investor, having contributed $10 million to date. So you might say I have some serious skin in the game. We plan on doing a Series B in 2021. We're looking for the right partners to help us grow and achieve our goal of helping to improve the lives of people everywhere. We have an experienced management team and with proven track records and strong financial and reputational commitments to the success of the company. It's not our first rodeo, and it's more than just about the money. Thank you.
Wonderful. Marzio, do we have you on the line?
Yep. Hi, Ava.
Hi. So for everyone in the audience, that poll did pop up for you if you'd like an intro. And Marzio, we do have a few questions for you. Can you provide Anura as an SDK for other apps?
Absolutely. That's what we're doing with all our B2B. So we have it as a B2C app for consumers, and then we have a version for B2B applications.
Great. And how accurate are the measurements and how far away from getting FDA or CE approved are you?
Yeah. So they're very accurate. If you want to really know, I have a whole chart going step by step, measurement by measurement. The one that we spent the most time making accurate to what I would say clinical grade or medical grade or FDA accuracy is our blood pressure. And we're now going to embark on trying to get it approved. I think our strategy is to do it with different partners in different regions. So we have a European partner who's going to be actually doing a major announcement tomorrow. I'm so happy. They're also a plug and play corporate partner, Ava, just so you should know. And they're going to they've adopted our blood pressure algorithm into their platform. They own about 5 hospitals. They run about actually 4 hospitals and 25 clinics. So they've already done the proof of concept, vetted it, and now we're going to work with them to get CE marking for it.
Wonderful. And we have time for one more question. Is there a need for a baseline measurement on the patient to determine differences?
No.
Okay.
Not required.
Well, great. Well, that's all the time we have today for questions. So thank you so much again for joining us.
Bye-bye, everyone.
Bye. Okay, so to wrap things up, I just want to give a big thank you to our fireside chat speakers, Fawad and Alex earlier, and also a big thank you to the 4 startups that showcased their solutions with you all today. We do have another health webinar coming up next week around early detection and preventative care. So feel free to jump on the Plug and Play website and register for that event next week. Again, my name is Ava. I'm the program manager. I run the program for health here in Silicon Valley. If you have any questions about the program, about Plug and Play, or any questions, or if you need introductions to the startups, please feel free to reach out to me. My email is on the screen. And last but not least, we have a little webinar survey. So if you could do us a big favor and help us rate this webinar so we can continue to improve and provide these great sessions for you. So with that, I'll give you all a minute or 2 to fill out that survey, and we'll see you next week. Bye, everyone. Take care.